heart disease is very preventable. It's estimated that 9 risk factors can account for approximately 90% of all patients who develop cardiovascular disease or heart disease. But when we consider risk factors, as you said, there are 2 types of risk factors: those that are considered to be modifiable and those that are not modifiable risk factors. And specifically, when we talk about non-modifiable risk factors, those are risk factors such as your age, your sex, and family history. We consider modifiable or treatable risk factors. There are many different treatable risk factors. Those include high blood pressure or hypertension, diabetes, high cholesterol or hyperlipidemia, smoking, physical inactivity, and many others. When we consider those individual risk factors, there are 2 specifically which are the most modifiable risk factors. We consider inactivity and smoking to be the most treatable, most modifiable risk factors. With those risk factors, depending upon the risk factor, you can significantly reduce your cardiovascular risk. When we consider smoking, with smoking cessation, it's estimated that the risk of cardiovascular disease due to smoking goes down by about 50% in the first year that patients are off cigarettes. When they continue to be off cigarettes, going on to 5, 10, or 15 years, over time the risk of somebody who smoked, who's off cigarettes, starts to approach that of somebody who's never smoked. So that's, again, good news for those people who do quit, that their risk starts to go down over the course of time and even just within the first year. When we consider obesity and physical inactivity, which are very closely linked, well, physical inactivity, again, one of the most treatable risk factors. For those patients that maintain an active lifestyle, exercise 5 days a week, 30 minutes a day, they can also significantly reduce their risk of cardiovascular disease anywhere from 30% and upwards. With obesity, obesity is a very important consideration for cardiovascular disease. It's associated with the metabolic syndrome and glucose intolerance and insulin resistance. Again, a very treatable risk factor, and by losing weight, patients can significantly reduce their risk of cardiovascular disease. We consider other risk factors such as hypertension. It's estimated that for every 20 millimeters of mercury that the systolic, that's that upper number blood pressure, is elevated, and every 10 millimeters of mercury that blood pressure is elevated for the diastolic pressure, a patient's risk of cardiovascular disease doubles over the course of 5 to 10 years. By treating high blood pressure, we know that we can reduce the risk of stroke by about 40%, the risk of heart failure by 30 to 40%, and the risk of having a heart attack by about 40% as well. So again, very treatable risk factors. With high cholesterol, those patients who do have high cholesterol, we need to have it treated before they develop heart disease or even after they've developed heart disease. We can reduce the risk of subsequent cardiac events or the first cardiac event by anywhere from 30 to 40%. So again, things that all risk factors can be treated and can help lower the risk.
Great.
Did I talk too fast?
Not at all.
Okay.
No, it was good.
I didn't even touch on diabetes, did I? So
No.
let's talk about one more risk factor too, diabetes.
Hold that mic
Thank
down.
you.
Okay.
Another important risk factor is diabetes. Another important risk factor is diabetes. We consider diabetes to be so important that it's considered a cardiovascular or heart disease risk equivalent. That means that if you have diabetes, your risk of having a heart attack is very similar to somebody who already has had heart disease and has had a heart attack. So we take diabetes very seriously, and when we look at the data for what diabetics die from, they don't die from diabetes, they die from heart disease and cardiovascular disease. So again, diabetics are patients who are at very high risk for heart disease, and we treat those patients very aggressively and treat their risk factors. We treat their high blood pressure more aggressively, we treat their cholesterol more aggressively, and we treat their overall cardiac risk more aggressively as well. Another group of patients who are at risk for heart disease are patients with kidney failure. Certainly, if anybody's concerned about kidney disease, they need to talk with their physician about that as well.
Okay. Is there an age where people should have these risk factors at the top of their mind?
We start to consider patients at increased risk for heart disease as they get older. We consider the heart disease risk to start to be higher for men when they reach age 45 and women when they reach age 55. That's in general what we see, that the development of heart disease in women tends to be about 10 years later than men. People are at risk for heart disease throughout their lifetime, but again, the risk starts to go up when we reach middle age, so 45 years in men and 55 in women.
Okay. What are the warning signs for people that may be at risk for heart disease?
Well, warning signs for people that are at risk for heart disease really revolves around risk factors. So knowing risk factors, knowing if you have a family history of heart disease and just what that entails. And it's worth reviewing that too, that we consider family history for heart disease to be one of premature heart disease in a first-degree relative. So what that means is if your mother or father or brother or sister has early heart disease, then you may be at risk for heart disease. Specifically, early heart disease we consider to be heart disease in men before age 55 and women before age 65. Now, realizing, of course, that almost everybody, 1 out of 3 people to 1 out of 2 people, will eventually die from cardiovascular disease, is a very common occurrence. However, your risk, the risk as it applies to you, really relates to premature coronary disease. And the other things to be concerned about, again, so depending upon your age, your risk starts to go up. No, I'm sorry, cut that, and take 2. So other warning signs that we talk about, again, as I said, knowing risk factors, knowing if you're hypertensive or not, knowing what the numbers are for hypertension, knowing, what, again, if, well, obviously you know if you smoke or not that you're at risk, knowing your blood sugar, knowing your cholesterol numbers also. Those are things, items that do increase your risk. Now, as far as warning symptoms for heart disease, that's a different story. Warning symptoms that people may have include chest pain symptoms. And chest pain, the term we use is angina, is a rather generic term for symptoms or chest pain symptoms that are from heart disease or blocked arteries. Now, angina may not be chest pain. Angina may be chest tightness. It may be a squeezing sensation. It may be shortness of breath in some people. It may be sweating or other symptoms like that. So it's not always chest pain. Some patients describe pressure in their chest or an elephant sitting on their chest. Those are warning signs and warning symptoms for a heart attack. That doesn't necessarily reflect those patients are just at increased risk. It's important to know, though, if you are at risk and that you may be having symptoms concerning for a heart attack, the best way to act, of course, is to call 911 and seek medical attention right away. Now, that being said, if you don't not having those symptoms but having risk factors, then if you have risk factors, that's when you need to talk to your doctor and talk to him or her about what your heart disease risk is and what other steps that you can take to evaluate that further if necessary.
Okay. And one last question. What's the message you want to get out to people about preventing heart disease?
The message that we stress for people about heart disease prevention is several-fold. One, the majority of heart attacks and the majority of patients who develop heart disease can do a lot to prevent that from happening. Many of the risk factors for heart disease are modifiable or treatable. It's important to know what your risk factors are. It's important to know to talk to your doctor about what risk factors you may or may not have. What we like to stress is the fact that knowledge is power, that knowing what your risk is and knowing what you can do about that risk is very important. And, well, no, I'm sorry, cut. Should I be looking at you or looking at the camera directly?
Either one is fine.
Okay.
Yeah.
I've been looking at the camera the whole time.
Yeah, that's perfect.
Take 2 also, add to this. In addition to knowing what your risk factors are, knowing that you can do a lot to treat those risk factors. And it's personal responsibility as well. It's taking the time, it's exercise, it's eating a healthy diet. And I encourage my patients to speak with a dietitian about just what a healthy diet is. Many patients want to talk to their physician about it. Most physicians either don't know or just don't spend enough time and don't frankly have the time to sit down and go through just what a heart-healthy diet is. But a lot of it's common sense too. And many patients who think that they eat healthy may in fact eat healthy, but they have too many calories. And this is where sitting down with a dietitian really provides you with the time and the information that you need to review just what your diet entails and how many calories you're eating. If you smoke, knowing to quit smoking and figuring out a way to quit. If you drink, drinking alcohol in moderation is key to a heart-healthy lifestyle as well. And again, knowing what those risk factors are and treating those risk factors.